I'm Dr. Reem. So, for you moms out there, you've had your crazy sleepless nights, your child's crying, fussy, not willing to eat, you don't know what's wrong, and you're thinking he or she might be teething. So let's talk about teething. Teething is basically when the teeth actually start to come in and they start to erupt. And a lot of times there's associated symptoms and pain, discomfort that goes with all that. But when it actually physically pokes through the gum, that's when we technically call it the teething process. And that usually lasts like a few weeks. One of the biggest myths out there is teething causes fever. So actually, when you do have your teeth coming in, you do have a slight elevation in temperature. But guess what? A slight elevation in temperature does not mean fever. A lot of the times what causes the fever is that your kid is so dehydrated. They're not eating, they're so cranky, they're not sleeping well, their immune system is not as good as it always is. So because of that, you're more likely to dehydrate, so they're more likely to get fevers. So myth number 2, diarrhea is not directly caused by teething and is not a normal sign of teething. And think about it, what also happens at 6 months of age? Your child's starting solids. They're transitioning from formula to milk. So that all those changes in the digestion system, in the bowel movements, all that could definitely cause diarrhea. Myth number 3, and I hear this one all the time. My child's putting their hands in their mouth, they're probably teething. Remember that usually at age 3 months, that's when your child's actually discovering their hands. So finding their hands and putting it in their mouth is actually a positive sign of development and shows that they're developing right where they should be. With teething, we definitely know that your child's gonna be irritable and fussy. That's normal. They're not sleeping well through the night. That's also normal. And most importantly, a lot of the times they lose interest in food and drinking, and that can lead to dehydration, eventually leading to fevers. Last but not least, drooling. So you get the excessive drooling, but you have to remember that at 3 to 4 months of age, that's when the salivary glands develop, and your child doesn't have the muscle reflex and the swallowing reflex. So instead of swallowing their saliva, they're just spitting it out and it all comes out. So it could seem like excessive drooling from teething when it actually could just be normal drooling. I hope this was helpful. If you have any comments or questions, please feel free to drop them below. I'd love to help you answer them. Thank you so much for watching.